Welcome to the Chattanooga Depression Care Member Interview Series. I'm Regina from Wellspring Coaching, and my world is all about helping people rebuild after depression. And I'm here today with Jason Therrien from Insight PT and Coaching. Thank you so much for being part of this conversation and being part of this community.
Absolutely, my pleasure.
I'm excited to talk to you about who you are, what you do, how it helps with depression, and why you do it.
Okay.
So some big questions, but I'll follow your lead and it'll be good.
Okay, so as you mentioned, my name is Jason Therrien. I'm a physical therapist and health coach. I own a practice called Insight PT and Coaching, which is a holistic form of physical therapy and coaching. And primarily my career has been centered around treating individuals with persistent or chronic pain. I've been doing that for I think going on 8 or 9 years now. And along the way, when you're working with a population like those who suffer with persistent pain, you'll inevitably encounter those who also endure depression, at least at times during their life or alongside their persistent pain symptoms.
We hear pain and suffering together all the time. And in your 9 years of expertise, like going deeper into chronic pain, you're like, oh, depression is also here. And how do I hold space for these things?
Absolutely. Yeah, it's a big part of the conversation, big part of the focus. One of the many silly jokes I'll make is I'm a physical therapist, not a psychotherapist. However, I might swerve out of my lane from time to time to provide maybe a bit of insight or perspective on how those two worlds might connect and maybe feed each other, and what maybe are some starting points for how to both care for the pain but also the depression. And that's an area that I've just tried to grow in as the longer that I've worked, and working with more and more people with pain. It just feels like an area that was needed to add to the repertoire of offerings that I have.
I'm really impressed with the way that you've been in this chronic pain world and you haven't looked away. Like instead of looking away and being like, okay, like I don't understand what's happening here, you looked closer and dove in and you're like, okay, there's so much depth to this thing and I'm here to help.
Yeah, that's an interesting perspective. So, yeah, I think for me, a lot of the reason why I went in this direction of working with people with chronic and persistent pain was because I realized how bad I was at treating it. And I just, started to work in a clinic where I was encountering folks with, chronic lower back pain, neck pain, all the different pain issues that a person might have. And some would respond well to the more conventional treatments that I was offering or that I had learned, but most, it didn't seem to make much difference, or I just felt ill-equipped to work with that population. And that, plus some other personal things, people in my life who experience persistent pain, the combination of those things led me to just want to dive deeper. And the deeper I dove into the world of chronic pain, the more excited I got, as strange as that might sound. I've always had a deep interest and fascination in the nervous system. And the more you learn about pain, the more you realize it's very much a nervous system issue, you might say. Something that is central to what the person might be experiencing. And additionally, when you learn more about the nervous system and you work with that population of people who experience chronic pain, emotions are inevitably going to be part of the conversation and part of what you learn about. And for me, in addition to always being kind of interested in the nervous system, I've always had fascination in human suffering, I guess you might say.
What it means to be human and why does it hurt?
Exactly. Before going into college, I wanted to be a psychologist, actually. My perspective quickly shifted over to physical therapy, and I went down that path. But in many ways, it feels like I've come full circle.
I was just thinking about this. Like, you're one of the people who you're like, why are these things separate? Like psychology, physical therapy, like very separate. And then you found the spot where they overlap.
Absolutely. Yeah, and there's so much overlap when it comes to our physical health, medically, or when it comes to movement, that intersects with who we are as people and our emotions and yeah, that's my favorite area to explore with patients or clients, is helping them understand how those two things connect, and offering different perspectives on how they might be able to deal with it better.
You've made a practice that is capable of holding pain
Correct.
and emotions and in that generative space and finding healing there.
Yes. Yeah. Well, that's the main goal. You know, I like to try to characterize my practice and what I do as holistic physical therapy and health coaching. And I think that's, while it's accurate, it's also, it can mean a million different things. It could be nutrition or acupuncture or body work, or it could be a lot of different things. I think the area that I do focus on the most is the personal side of it, and understanding how emotion and stress contributes to illness and pain over the course of time, and what one can do to better understand that on a more general level, but also more importantly on a personal level, and then what steps might be needed next to provide better care to themselves. And a lot of that has to do with connecting with their body, and that's probably the central theme to all that I do, is coming home to their body and being a companion to them on that journey inwardly.
The relationship you have to pain and what that is characterized by. And then, like, in my framework of the disconnection map, connection to body is one of the 5 like main pillars. And so you go with so much depth into that.
Absolutely. And I feel like the deeper one might travel down that trailhead of the felt experience of their body, the more they'll come to understand themselves. So, I mean that in many ways, but let's just start with something like emotions themselves. If you're having an emotion, it's going to be a combination of things. It's not something that you feel in your mind or with your thoughts. It might be in relationship to that, so something that you're looking at or listening to, or some thought that you're having, a memory or a belief perhaps. But the full experience of the emotion is experienced in the body. And helping folks understand on a personal level and an experiential level, not just a conceptual one, that their feelings are felt in their bodies, is a big part of that process of coming home to themselves. So, for example, if a person is anxious, they might have something to be anxious about, and that might explain the why, but the what of it is pressure in their chest, or tightness in their belly, or a clenching in their throat.
What does this experience mean in this particular body?
Correct. And I think meaning is always important, and I spend a good bit of time helping people make sense of things. But I think the longer I work with folks, and the more kind of experience and training that I undergo, the more emphasis I put on the what, and not so much the why. And it's more of like, this is here now. Maybe there's anxiety, and there's also resistance to the anxiety. And what does that feel like?
Yeah.
And anger. Oh yeah, there's a lot of different dynamics at play inside of a person, and that can all be experienced or felt or tasted or sensed in their physical body, and sometimes just outside of their body, which is kind of groovy. But helping provide the right suggestion, or maybe guidance. Guide is, I think, a good word to help guide a person and their attention to the moment-to-moment unfolding of their inner experience. Isn't just, again, a process of understanding this is what an emotion feels like. It's, this is what I'm experiencing right now, and that personal insight or that personal awareness can be a real revelation for them.
Yeah. Brene Brown talks about like the courage to walk alongside. And so you practice the courage to walk alongside like deep pain, chronic pain specifically. And I want to hear more about your understanding of chronic pain and depression, because depression is also one of those big scary things. Before we get into that, I wanted to point out too, chronic pain and depression are things that, like, as an individual, it's really hard to walk alongside within yourself. So having somebody who's willing to walk alongside you as you do that and not look away and not be afraid makes a world of difference.
Absolutely.
And that's why we're here.
Yeah, absolutely. And I'm really grateful to you and people like you who are willing to bring people together for this common, very important purpose. Walking alongside people on that journey, companioning them is, I think, a really healthy and wholesome way of framing that. And one thing that I've come to understand, both personally and professionally, is that for many, learning how to hold their own inner experience is something that never developed. And that's a big conversation on its own. But for whatever reason, learning how to understand themselves in that way and be whole and authentic and aware of themselves on an experiential level is just something that they missed in their development in many ways. And most of us have.
And talking about it as like a skill that you can learn,
Correct.
rather than it's not something you have or you don't have.
Absolutely. And that skill, I think, is not something that is taught in a more traditional learning system.
Yeah.
It's more of something that can be modeled. And this is an idea that I've been sitting with for a while, that in many ways the companioning that I offer for those who are interested and willing and courageous enough to get to know what's happening inside of themselves.
To take an honest look.
Absolutely. That kind of companioning is also, in a way, a modeling for how they can then learn to hold their own inner experience. So that's been a really interesting and fun revelation for me in terms of how I can work with people is really just holding space for them until they're able to hold space for themselves.
And it comes from a depth of you having learned how to hold space for yourself and you doing the work, like being capable of becoming a coach and capable of holding these deep spaces and then being able to companion someone.
Yeah. And on that note, that's a fun one to think about, because I also like to jokingly say that one advantage of not being a therapist is I feel like I can just let all of my imperfections and areas for further improvement just be fully on offer and advertised. So in other words, I feel like there's a relatability that I can offer. It's like I'm still on my own path. I'm still
a human too.
For sure.
Yeah.
And I've got a lot of inner companioning yet to do. But yeah, it's fun both getting to know oneself in this process and what comes up for me, for example, when I'm working with other people, but then also learning how to provide that space and to be that companion for them so that they can come home to themselves.
That coming home. You and Lo both talk about coming home to yourself, and I get to see so many like synchronicities in this like deep work that we're doing in this community. So I'm really excited to hear specifically from you about that landscape of chronic pain and depression. What have you learned?
What have I learned? So let me put my caveats and disclaimers in. I do not pretend to know everything about the clinical or diagnostic components of depression. I know a bit about it, but I would not say that that's a strength or an area of expertise. Working with it, I feel like, is something I do on a regular basis without ever uttering the word depression. Yep. It's just something that is here. It's in the moment with the person, and it's something that they can get to know and how it unfolds inside of themselves. And my job is to help just provide the right reflections and reminders and guidance along the way. So as far as what I understand about it, I like to reference one of my favorite thinkers and authors and clinicians, Gabor Mate, and his, he just has a great way of really breaking things down in a useful and truthful way. And he talks about depression in physics terms, like what does it mean to depress something, like depress a lever,
to push it down.
To push it down. It's like, so there's something that might be hard to be with inside. What that something is, why it's there.
That's what you were saying earlier. Like sometimes the why matters, but so often the what is what really matters.
Right. So I don't work with a person to treat their depression in that sense. But if they're experiencing depression and depressive symptoms, then I might offer them suggestion and maybe, if they're willing and interested, provide them some prompts and cues and instruction on how to maybe get curious about what's showing up inside and how that might be presenting itself in that moment. And along the way, insight naturally will reveal itself. People will get to know and be more understanding of what might be underneath those symptoms and sensations inside their body by first learning how to just be with what's here in a mindful and a non-judgmental and non-violent way.
Do you want to demonstrate some of the questions you ask?
Sure, yeah. So one of, I guess, a classic question, I think, in psychotherapy in general, but definitely in what I do is, what are you noticing? What's showing up right now? So let's say that a person's coming to me and our primary focus is more around pain and movement and function. However, maybe they're sharing with me, in fact, I'm thinking about a patient I saw today whose persistent pain has had such a substantial impact on her life and has for many, many years.
It's a big thing.
It's a huge thing, and I think she has been diagnosed, check the box for clinical depression, and in our session, became very emotional several times, and it was our first session, so we didn't really get into it, but what I might offer in that situation is first, just an opportunity to ground her attention in the present moment.
What's in this room? What's here now?
Correct. What's in this room? What does it feel like to be sitting? How do you, what shows up inside your body that lets you know that you're in a body that's sitting and not standing or walking?
What lets you know that you're in a body? That's a fun question.
Right. So you might notice the pressure where your body makes contact with the chair. You can do this with your eyes closed, but open is okay too. You might notice how you've positioned your body. You have this thing called proprioception.
Well, now I'm thinking about how my knees are feeling when they're crossed, and where's my back, and
You can feel the bend in your knee and the bend in your hip, maybe the pressure of your left foot on the ground right now. So I might just ask them to start getting curious about anything that might bring them to the here and the now. It's another silly Jasonism is it's our minds that like to wander, but it's our bodies that bring us home. Yeah. And I just try to help remind people that your body will bring you back to the present moment.
I learned a really funny way about getting in your body yesterday. She was talking, one of my favorite teachers was talking, and she's like, yeah, squeeze your glutes. And I was like, well, that will get you in your body.
Yep.
I'm back. Yeah, so I thought that one was fun. And again, we were talking a little bit before we started recording about how there can be lightheartedness and silliness, and it doesn't have to be serious.
Absolutely.
Like watching how kids get in their body is always really fun.
For sure, that's a good reminder, and I'm glad that occurred for us here a moment ago. Another way to maybe start that grounding process is the breath. I use the breath all the time. I had a long history with breathing and maybe a little reluctance to incorporate it into my approach, and that's another conversation, but it's a central theme for what I do and so much of how I work with people. And it's complicated why it's so important. It's not exactly obvious, I think. So anywho, just understanding that you can use something like the breath or your sensations in your body to bring you to here and now, but also, things in the room around you. Absolutely. Senses, external senses, internal sensations, anything that brings you here. Then I might just ask them to notice what already feels, maybe, if we've worked together for a while, what already feels open, what already feels at ease, just to kind of give them a reference point for what it feels like to be in their body when it's not in an unpleasant or undesirable state. But then, again, after we've kind of grounded and we've made contact in that way, then I might ask them to notice what's coming up for them. And specifically what I mean by that, and I'll try to steer their attention into the felt sense of what's coming up or the experience inside their body. So they might notice sadness or fear or anger or some version of one of those things.
I feel numb, I'm wrapped in gauze. Those are some phrases I've heard.
Yeah, those are. I've not heard the wrapped in gauze, but I've heard things similar to that.
Yeah.
So I might just, I would ask them to maybe get curious about that for a moment. It's like, you might just take a little time to notice how you would describe that to me. And then you might sense if it's okay to just be with that feeling for a moment and just be with that sensation. And just giving a person that kind of instruction or permission or cue to just be with what's here by itself can go a very long way. Maybe even acknowledging it. It's like, hey, there's something in me that's feeling like wrapped in gauze or feeling sad.
Permission for them to feel what's going on with the reassurance, like, I'm here. It's okay.
That's right. And that I am willing to walk alongside them on this path, but I'm not going to force them or insist on anything or trying to change anything. It's one of those many paradoxes about
Insight.
about light, or about insight, or how we work with people, or what leads to genuine transformation is not trying so hard much of the time. So yeah, I might ask them to notice what that's like inside, and it's always evolving, the process I have. But some of the first things that I would like to help a person recognize is the resistance that they have, the part of them inside that's saying no to what's here. In many ways, that's often the more important starting point. It's not so much the sadness or what it is, what's inside that's scary or hard to be with. It's the part of them that's resistant and maybe angry or really irritated about whatever else might be going on. They might need to work with that feeling first. I mean, often the case with pain is the resistance to pain. And you mentioned suffering, and the way I think about suffering from my Buddhist background is that suffering is loosely equivalent to pain multiplied times resistance.
Ooh, what a formula.
Yeah, and it feels very true, and it continues to manifest in my working with people, my clinical practice, in a way that makes a lot of sense to people, and also it feels accurate when. And the reason why I say that is because you can substitute pain with any sort of unpleasant human experience, and you multiply that times the thing or the something or the part of you inside that's saying no to that. Saying no, this shouldn't be this way. Shouldn't have been this way. Shouldn't continue to be this way, and it definitely shouldn't be this way right now. And just getting curious about that part. And that part's not bad or wrong for wanting it not to be that way. However, the resistance to it is what makes it persist. Exactly.
So people come to you with chronic persistent pain and they want to stop hurting, and then they learn how to get curious and how to be with the pain, and in so doing unlock this paradox.
To be clear, that's not where we start. That would not be necessarily a great way to get people to come back to see me a second visit. Initially, a lot of what the work is about is self-care practices and techniques to help relax their body, to learn how to unclench the fist, so to speak, or learn how to relax the tension and tightness.
So before you can hold space for the resistance, you have to be able to open your hands.
Right.
So you start with the relaxing.
Exactly. It's essentially offering different resources for a person to be able to call upon and utilize, and also to me, with the whole insight paradigm that I feel like I represent, or that I allowed to move through me, is about these revelations and recognitions of what's happening inside of themselves. So, for example, when a person learns that they've been holding their breath all day long or most of the day, and then they start using something like a simple breathing practice to notice that more often, and then start to deepen their breath, and that leads to a symptom change. And I'm not saying symptom elimination, that breathing will take all your pain away or your depression, but it might shift a little. It's like, well, maybe there's more that I didn't understand before. Maybe there's more not only to the story here with my pain or my illness or my emotions, but there's also something that I can do about it that is within my control. So that's kind of the starting point.
Some agency and curiosity and shifting it a bit.
Right.
So to kind of summarize, Jason Therrien, Insight PT and Coaching, health coaching and PT to help shift relationships with pain.
Yeah.
I don't know if that's the best way to say it.
Yeah, that's. I think that's a good. I mean, it's a struggle sometimes for me to explain what I do.
World.
But I do think a huge part of what I do is about changing one's relationship with their pain, and let me say first understanding it, because I think ultimately
insight's the first step.
Right.
That's why it's called this. Yes.
Exactly, and I don't think anyone would come to me not wanting to change, right? So it's kind of implicit. But yeah, the point is to evolve or allow for a shift and transformation in one's relationship to their body and also themselves, and how those two things are very much intertwined as well. That there's a theory that I've been cooking up for a while that I call the pain relationship theory. And one of the principles is that your relationship to pain reflects your relationship to other kinds of pain, like emotional pain, like depression, perhaps. That if you have a resistant relationship with your body, that it's not doing what you think it ought to be doing, or it's falling apart on you, or it's not good enough, or etc. It's not unlikely, in my experience, that that sort of relationship also exists with parts of yourself, and that there's a part of you that might have a lot of strong rejecting kind of beliefs and attitudes about oneself and about one's history, or things that may have happened, things that we might hold a lot of guilt or regret about.
Your pain and your depression are telling you things about your relationship with yourself.
Absolutely. And then,
oh, for sure.
Yeah, and the point there isn't to then say, hey, stop doing that. It's like, okay, you might just get
Maybe
curious.
you want to learn about what it's telling you.
That's right, absolutely.
Yeah.
And I think that, going back to the coming home thing, I think whether it's pain or other forms of chronic illness or other maybe mental health conditions, they're complicated. There are a lot of things that contribute to it. Some of those things are more, let's say, practical or lifestyle oriented, like sleep and diet and things like that.
Tangible.
Right. But I think in many ways, the whole notion about coming home for me is that your body brings you home. And you can continue on in whatever way you've been continuing and whatever's allowed you to move through life and to overcome challenges. These aren't problems, these are your answers. These are the things that you've utilized to help overcome these challenges. However, given enough time, the body will bring you home. It may slow you down. It may get you to the point where you need to stop and check in and realize that maybe your pain or your depression or your illness isn't trying to punish you, or it's not necessarily bad luck or random. Maybe it's trying to get you to check in on something that needs your attention and care.
I love that so much. I talk about like depression as a check engine light, where it's a hard stop for you to like take a look at, okay, what's going on? Where am I disconnected? And so I love this idea of like, hey, like let's get under the hood and look and see what these things that are very much, I don't like this situation.
Yeah.
I want it to be different. What are they telling us about being human?
Absolutely.
And the fact that you live in your body, like your body is your home.
It is.
And
you come to this planet in it. You leave this planet in it. I love to explore the expression, home is where the heart is. Everyone has
Like your
heard
literal heart.
Exactly. So what if we've been getting that whole idea wrong, that it's not a figurative statement, it's actually a literal one. Home is where your heart is. Your heart is in your body. This is the place. So even the notion of home being the figurative place where you find love and connection and safety and acceptance and lightheartedness.
These concepts.
All these concepts are still also felt in your body. So if you feel safe and connected and at home and peaceful and at ease, that's experienced in here as well. So yeah, I feel like our bodies are our true homes, and it is what helps us be. I don't know, in my opinion, I don't know that healing on any level is first of all, it's an unattainable thing in many ways, depending on how you look at it. But the process of healing, the process of again becoming to feel better, the process of feeling better is about wholeness, and authenticity and healing. I don't think can happen if you leave the body out of it.
Nope.
And I feel like it's not just true that you include the body, but it is through the body.
Like we say mind-body all the time, but it's probably more accurate to do body-mind.
I won't disagree. It depends on how you define your terms,
Exactly.
of course. But
it's like,
yes.
where does this fit in all the things?
Yeah.
So I guess, do you have any closing things you want people to know about where to find you and how to work with you?
Yeah, I hadn't thought about that. So, I have a website. You're welcome to visit it. It's insightempowers.com. You've got lots of ways to interact with the website. There's a resources page, and it's got videos that go into some detail about pain and how it works, and different sort of metaphors like the bear and I'll just let that be a little
I was like, we need
cliffhanger.
to do like a whole series on all
We
of
c-
these things. But yeah, anyway,
we
continue.
might need to. So there's all these different, educational topics, but then there's also these breathing practices that I encourage that I call the deep and easies, and it's not
The
that
deep and easy.
the deep and easies. There's all sorts of breathing practices out there, so be clear that
Coming home to your body via your breath.
why not, right? So try this one, and then maybe see if it feels good or not. If it doesn't, use some other breathing practice, but something that will help bring you to your body, and the breath
Find
is
one that
great.
works for your particular body.
100%.
Yep.
In addition, there's some other interesting things like other podcast interviews I've been a part of. As far as working with me,
You do one-on-one coaching, right?
I do one-on-one coaching. So for anyone who is across state lines, I'm licensed as a physical therapist in the state of Tennessee, but as a coach, I can work with anyone anywhere. So we just have to be a little bit, specific about what our intentions are and how we frame our working relationship.
Yeah.
But a lot of the things that I might incorporate in my PT patient therapist relationship are also going to be included in the client coach relationship. So yeah, if you reach out, there's links for how to contact me. There's also a class that I have. It's a virtual class, so that can also be attended from anywhere.
Yeah.
It's on Fridays at 12. It's called Caring for Pain. And anyone's invited to come, even if the kind of pain that they're experiencing is more of the mental and emotional variety. I feel like this would
Pain
also
is
be
a
helpful.
word that fits so many things.
I think so
Yeah.
too, absolutely. Defining pain, that's a whole other conversation as well. But yeah, those are a couple ways that you can get to know me. If you're here or work with me, if you're here locally, we're shooting this in my clinic space at Chattanooga Holistic Medicine. You could sign up for a session that way as well. They have their own website and scheduling system, and you can just click on my name and book a free 30-minute consultation if you'd like. Get to know each other that way.
Cool. I'll have both of those links in the description. And thank you. Anything else? Any last words?
No, I mean, you don't want to start me down
We
the
could
path
just
because I
keep-
could just keep going.
Yeah, so if you want changing your relationship with pain and so much depth and richness and continued conversation, this is your guy. So
Yeah.
thank you.
Thank you,
Thank you.
Regina. I appreciate it.
Yeah.